I think the best leaders are the ones you find at the back of rooms who influence everyone, but you can't find them.
There are varying levels of consumer representation. As we become more mature with consumer representation and its purpose, we'll actually find that there are different layers, of which consumer leadership is one of them. It allows us to bring people together who can actually work around an aspiration that keeps us focused on what we're trying to achieve. And that's, to me, what leadership actually does. It allows us to come together and unify our very diverse voices in a way that has systemic significance.
I think there is a role for consumer leadership in Australia. So I think there's a real need for the support of other consumers. So I feel like I've stepped into that leadership role myself now. Researchers themselves need assistance and support in engaging with consumers. They don't necessarily know how to do it. So I think as a consumer leader, I can assist researchers because I have that experience myself as a consumer. I can share with them my experiences and give them the confidence to engage with a consumer who perhaps isn't so experienced.
It's really important to have at all stages, at all levels, that consumer voice. I do see that there is a really important role for having a strong consumer voice in health systems. So say, for example, you know, in West Australia, we have a system manager, and then we have 5 health service provider bodies. That they're the main ones that provide services anyway. So making sure there is somebody who sits at the highest level, that is really key. That's really, really key. And I think also bringing us together, bringing the consumer leaders together. I see when we're talking about workforce quite a lot in the West as part of the Sustainable Health Review reform, we are continuing to advocate for that conversation around workforce needs to include the consumer leader pipeline and how we continue to ensure that there are people that can operate at a board level as well as at a ward level. If the lived experience voice isn't at the table, then whatever you end up with isn't going to have the same impact. And it's what we're really here for is to make things better. In this case, you know, a healthier life, a more full life. And so if we are trying to create systems and policies and services without the lived experience voice, we're not going to get the cut through we want.